Welcome back. This is part 5 of Hope Corps' core concept in global health. And in part 4, we just looked at this particular growth chart and the importance of it, looking at the fact that what we're going to need to do is two things. We're going to need to reduce the mortality and burden of disease here. And because there's evidence here that these children had low birth weight and therefore the mothers have been impacted, we need to focus on the health of the mothers also. We've also talked about the fact that we don't want to just do mortality reduction. We always want to combine that with fertility reduction, allowing women to have the means and understand how they can voluntarily control their own fertility. And of course, the idea is to avoid a child that we've talked about before. And there are millions of these children in the world right now. And by 2050, 39% of the new UN population figures, 39% of the children of the world will be on the continent of Africa, which is the continent that has the least resources to care for those children. So what we're facing here is the possibility of millions more of these children. So again, we're looking to do things that are extremely medical effective, extremely cost effective, and that can be scaled up literally to hundreds of millions, billions of people. And so to do that, we're now going to take a look at we're just going to look at mortality reduction for a second, and in a later video we will talk about family planning and giving women the ability to do fertility reduction. But we're always going to talk about that, realizing that that quality global health in the 21st century is always going to do those same things. It's going to be multidimensional. It's going to offer curative services, fertility reduction services. And to do that, at least on the mortality end, let's look at what I'm going to call childhood survival technologies. So basically, what you have is that in the end of the 20th century, there was some incredible advances in simple, inexpensive medical technologies, which really have revolutionized child survival all around the world. And wherever these technologies then are delivered, you see marked reductions in infant mortality and marked increase in under 5 survival. So, and it's very much like a stack of pancakes. If you add only vaccines, you get a reduction in mortality. But if you add vaccines and simple antibiotics, you get a bigger reduction. And then if you add oral rehydration therapy to treat diarrheal diseases and dehydration, you get more. And it just keeps going down the line. So, of course, what we want to do at Village Hope Corps International is we want to add all of these, not some of them, but all of them to what's going on with these children in the developing world. So we're going to probably do a video on each one of these particular things, but I want to introduce these right now, and I later will go on in another video to show you that we have very good data that this actually works, that in millions and millions of people we can show a marked decreased mortality in children if you just do these things which are on this particular list, with maybe there's a couple things that are not on here, like vitamin A supplementation, and also the deworming in children who live in areas of soil transmitted helminths, which would be mostly things like hookworm and ascaris. But in general, what we have here are the drivers of what's going to create good health in the children that we're talking about. And so obviously vaccines are very well understood. Of course, in the developed world right now, the problem is that the diseases that we immunize against, because we've immunized for so long, are of so low frequency that the discussion of vaccines is not about whether they work or not, it's about their side effects. But when you go into the developing world, that all changes, because diseases like tetanus and pertussis and measles are huge killers. And the reason they're killers, of course, is because of what's happening to these children's immune systems that you saw on the prior video. As far as the growth chart of those children that are born in extreme poverty, and how malnourishment really decreases their humoral immunity and their cellular immunity and makes them more susceptible for very severe outcomes for these particular situations. So vaccines become extremely important, and they're very, very cheap in the developing world. The WHO vaccines really only cost I think now only a little more than $1 to $2 per child for all the vaccines together. Simple antibiotics also are inexpensive. Certainly we can give courses of antibiotics to children in Kenya for less than $1 for a whole course. Oral rehydration therapy, which we will look at in a different video in detail, was an incredible advance in global health. Some of my mentors were involved in it, and it basically was the fact that prior to, let's say, the 1970s, the number one killer of poor children in the world was diarrhea with dehydration. And number two was pneumonia or pneumonitis in those children. Since then, pneumonitis has taken over number one because so many more children survive because they have diarrheal illnesses, but they don't die of the dehydration. So we learned to be able to give a solution that includes electrolytes and sugar that would allow somebody to orally and easily rehydrate a child without intravenous rehydration and expensive other medical interventions. And we'll talk about that later. Protein supplementation, again, in children that are getting in trouble, children that are falling off their growth chart, extremely important, because remember, you're not just putting weight on a child, but you're protecting the child's immune system. That's critical. The other thing that you're doing that we have not yet talked about, which we will definitely focus on, is that in the first 2 years of life, a child gets 90% of their brain weight. 80 to 90% of their brain weight and brain structure then occurs in the first 2 years of life. If you're malnourished and you do not get that structure, no matter what we do for you after, no matter how we educate you, no matter how we feed you, you will never reach your normal mental potential. So literally, protein supplementation and being sure that children reach 2 years of age with a normal brain structure is extremely important. We'll talk about that. Growth chart monitoring, we just looked at a growth chart, how important it is to follow children, to find out which children are having problems. And as you've seen before, if we keep tabs on growth charts, we can look at a whole community. It's an incredible epidemiological tool that unfortunately people in the developing world don't take seriously enough. They don't keep the growth charts up properly, but growth charts are extremely important, and they help us make decisions for whole villages, whole populations. Child spacing then has shown that it's good for the mother and for the children. And the situation of what's going on is basically a mother that has a child every year or every 15 months. That's a huge stress on a woman's metabolic processes, and can result in her own malnutrition and disease entities like malaria and other particular problems. And so by just child spacing to at least a minimum of 2 years between children, if better 3 years, but definitely at least 2 years, then you can improve the health of the individual children and the mothers by just doing that and doing none of the other things. Obviously, we want to add them all because they're all relatively simple, and they're also relatively really inexpensive. The prenatal care and education of the mother is extremely important. Obviously, infant mortality in the first year of life is very, very important. We're going to look at that. And if you look, infant mortality basically is the number of children that die per live births, per 1,000 live births in the first year of their lives. And if you look at infant mortality rates, we've basically, if you wish, picked the low-hanging fruit and have taken care of so many of the easiest problems to take care of in the first year of your life. And so now about 48%, 45 to let's say 50% of infant mortality and deaths occur in the first month of a child's life. So again, perinatal care and perinatal education of the mother is extremely important. And things like breastfeeding, which is down below, vitamin A supplementation later on as the child gets older, treated bed nets if the child lives like in our area, in an area of significant risk for malaria. That's extremely important. And so those are going to be the child survival technologies. They're the drivers of the good numbers. And as we put those on, as we begin to add them to poor populations, and particularly when we take these things and bring them to the people, we get out of our clinics, out of our offices, out of our hospitals, because these are preventative measures, and people do not come in the developing world for prevention. They come when they're ill. So we need to get these into the schools, into the neighborhoods, into the marketplaces, and of course that's what Village Hope Corps does, and that's why we're unique, and that's why we've won the awards we've won. At the bottom, of course, is family planning, just to remind us that just doing this mortality reduction is simply not enough. We are going to have to educate women and provide family planning and give them access to family planning so they can make their own decisions and that they can control their own fertility. So we will then revisit this and we will probably do one video on each one of these things because they're so important. That'll be a while before that will occur. But when this video, this series of videos is really moving from the basic core concepts and ideas of global health, and will eventually then get right down to what we do at Hope Corps every day in the field. So we're delivering then child maternal health to over 100,000 women and children living in 516 villages on the slopes of Mount Kenya. And we're getting to where that, we will be looking at where that is in Africa, what are the characteristics, what are the nutritional characteristics, the climatic characteristics of that area, which affect the ability to produce or not produce enough food. And then we will look at actually what Village Hope Corps International does in the field. But first, before we do that, it's important to understand the core concepts of why we're doing those things. And one of the main core concepts is the importance of the child survival technologies that are right in front of us on this screen. Again, they're extremely medically effective. They've been well tested in all 6 continents, and they're very cost effective. And certainly if we're going to prepare for the children of 2050, this is the best way to do that, is to learn how to deliver child survival technology directly to the woman and child that needs it into the community, and then combine that, of course, with fertility reduction strategies so that the mother can control her own fertility. All right, we will be back then.